Hi, I'm Dr. Ashish Davalbhakta at Aesthetics Medispa and Advanced Aesthetics in Pune, and in today's educational video we are going to discuss and analyze another case of rhinoplasty. Here this young lady had concerns that she felt that her nose was broad. There was also another concern that she had a hump and in the side view, as you can see here in the side view, she felt this was a hump. So we analyzed her photographs, and as we analyzed, the first thing that we did was to see if she had a deviation in her nose. So if you see, her nose was balanced, so she had no deviation. However, her nostril base was wide, and that you can determine by placing these markers, and you can see that they are slightly lateral to the inner angle of the eye where the nostril base should be ideally, and her bony base almost corresponded to where her nostril base should be, and that should ideally be around 80% less than the nostril base. So if the nostril base was moved here, then the bony base would have to be moved in. So we concluded that she would need an osteotomy and an alar base correction. But to increase or improve the sharpness of her nose and to deal with her hump, we looked at her side photograph. And what this tells us is that the nose is actually starting at the pupillary line, while it should ideally start at the eyelash here. So if it started there, then she actually has a low radix or a low bridge of a root of her nose, and the tip is also slightly drooping or under projected because her nasolabial angle is less than 90 degrees. This in women should be 95 to 120 degrees. So her tip needed to be lifted up. That would also help the nostrils to be seen a little bit from the front. So if we lifted this up, then she ideally needed an augmentation and not a hump reduction. So how did we confirm on that? We looked at her nose from below, and here her nostrils are reclining or horizontally placed. They are oblong. There is an asymmetry because of the deviation of her septum, but they are more reclining than the vertically inclined position that they should be. So this tells us that her tip should be lifted up and she needed an augmentation. After discussions, we agreed that we would try to use this part of her septum because she didn't need a lot of augmentation, and we would lift up or build the bridge with what I call is a U-graft from the septum. So this is very kind of a technique that we have developed here in our center, and we develop a graft from the septum in the shape of a U and place it in the midline on the top, and you can see the appearance postoperatively, and you can see how it has improved the dorsal aesthetic lines. They are sharp, they are parallel. The tip projection has been increased or improved, and that's why you are seeing a little bit of the nostrils from the front. When you see her from the side view, you can see that the bridge has very subtly been increased. The hump has gone, the tip projection has been lifted up, and it's now a fairly balanced profile. If you look at the basal view, you can see that the asymmetry is there, partly because of the long-standing nature of the deviation and the laxity of the tissues and on the right nostril, but you can see on the left nostril the inclination has improved from the more horizontal that it was. We also brought the alar base in, and that has narrowed the nostril base, and that is the reason why from this she is now looking like this. You can see the balanced nose, which is making her look very pretty. Everything is in proportion. The side view has changed very subtly. You can see that there is a little bit of increase at the root, and the tip has been lifted up, and all in all the appearance has changed to a very pleasant appearance. So she's fairly happy, and I would like to thank her for giving permission to use her photographs for this educational video. If you like this video, please click the like button, subscribe if you want to learn more about techniques such as these that we use in our clinic. Thank you.